All right, let's take you back now to that conversation with the Department of National Health. Spokesperson Foster Mohale is on the line, and it's obviously about the cholera outbreak or the cases that we've seen in Gauteng specifically over the last month. Foster, I hope you can hear me this time. I know that your connection is bad, but we'll keep it short. Just talk to us about the samples that you have now gone and taken at Yaks-Bay and Klip Rivers specifically. We know, of course, that the 11 cases that have been confirmed in the country are all from Gauteng. Talk to us about the latest.
Good afternoon to you and good afternoon to your viewers at home, and thanks for this opportunity. Apology for this network connectivity. Yes, indeed, as the Department of Health, we are very concerned about the rising numbers of cholera positive cases in the country, especially in Gauteng, under the city of Johannesburg and Ekurhuleni. Yes, you are right. As the department, we have deployed our health practitioners to go and collect the water samples from Yaks-Bay River, which is around Santen and Alexander, and also the Klip River, which is around Ekurhuleni, in order to establish if indeed the water from the two rivers they contributed to the number of cholera in the country. As we've been established during our investigations, that the recent 4 cases, they admitted that they were baptized at these rivers and were also made to drink water from the two rivers, which contributed to the rising number of cases. So hence we say until we get the samples, the results from the samples, we'll be able to confirm if indeed the water is contaminated, then we'll assist in terms of the way forward.
Has the Department of Health declared this as an outbreak? And if not, when will you do so?
For now, it's too early for the department to declare the outbreak, especially because we have not yet established the source of local infections, unlike in other countries where they are very sure that the water is contaminated. The countries like Malawi, Mozambique, and Zimbabwe and Zambia. So in the country, we are still trying to establish whether this the water from the two rivers are the main source of these local infections. But what we want to do now, while we're still waiting for the results from the lab, we want to call upon our people, especially those who are staying around those areas, the Ekurhuleni and city of Johannesburg, to say, especially our religious and traditional leaders who practice their baptism practices in those areas, to say, please, as they practice their cultural and traditional religious leaders, they should avoid telling their members or followers to drink water from these rivers, because we cannot guarantee the safety of the water, only the tap water. So as they do that, they must do that responsibly, and also try to ensure that we try to maintain hand hygiene at all times. For now, we say, let's try to avoid drinking or using the water from the rivers for drinking or preparing food until we receive confirmation that if indeed the water is contaminated.
Would you say from your end there's been enough awareness to warn South Africans, particularly the ones in Gauteng, especially because you're still doing investigations a month on since the first case?
Yeah, we have got the parallel processes. While we continue the investigation, the contact tracing, but at the same time, we also assist with what we call the public education and raising awareness, especially in the affected districts. We've reached more than almost 2,000 people in the areas like Ekurhuleni and city of Johannesburg, especially around the Diepsloot, where the problem is. So we continuously raise awareness and empower our people with health education in order to make well-informed choice. Also try to raise awareness about the cholera-like symptoms in order to ensure that everyone who experiences cholera-like symptoms, we talk about vomiting, diarrhea, your body pains, or dehydration, whether they've got local or international travel history, they don't have to waste time. They must go to their nearest health facility, clinic, or hospital in order to enable our health workers or the doctors to screen and test, so that if they test positive, then they can quickly get treatment immediately without wasting time, because we always say early detection saves lives. So for now, because we don't know where are these cases, apart from the first 2 cases that we are sure that they come from Malawi, but the source of local infections, until we establish that, we say, please don't waste time. If you experience this, signs and symptoms of cholera, go to your nearest clinic in order to save your lives.
Foster Mohale, thank you so much for your time. He's from the National Health Department. And of course, Gauteng has now 11 confirmed cases of cholera since the outbreak started early last month.